okay? So what we're going to do today is basically start discussion on Learning Outcome 2. And this discussion on Learning Outcome 2 is going to be looking at, covering understanding equality, diversity, discrimination in relation to, person-centered approaches. Now, the reason why we are looking at understanding this is because when we look at the National Health Service and we look at the health and social care sector in general, what we do realize is that there are different people which work from different backgrounds, and the setup of the UK education, health and social care sector is quite diverse. So there are, people who work from and have come from different backgrounds, they have different beliefs, different values. And in this case, it is important for us to understand and respect the diversity, which is primarily, making up the, staff and employees, contractors, suppliers of the National Health Service, and in general, the health and social care sector. So here in this particular learning outcome, we are focused on, looking at understanding details about the key laws and legislation which are going to be effective in the context of, the person-centered approach. So here, the main objective of studying this particular learning outcome in terms of the person-centered approach is looking at, one, to understand, basic laws like Equality and Diversity Discrimination Act, Data Protection Act. We're looking at, the Working Rights Act, some of the major acts which are going to be observed by us when we work within this sector as a health and social care professional. The other bit that we will be looking at is understanding what could be the various sources of information which could be looked at to derive information about the key areas of equality, diversity, and what constitutes discrimination. And what we need to be doing is steering away from the aspect of how or where discrimination essentially can happen. And then one of the assessment criteria in this particular learning outcome is to assess the effectiveness of national initiatives. What is the government's role in promoting equality, diversity, and non-discrimination when we see the health and social care sector, and how do they look at, proposing policies at the local, regional, and national level, which are then implemented by relevant, authorities to ensure that there is no discrimination which happens when we look at, providing person-centered care. Now, there is a fair bit of learning outcome and indicative content in the learning outcome to be covered, but we'll be broadly looking at, firstly, the definitions of what is equality. We'll be looking at what is diversity. We'll be looking at what is discrimination. These are the three key words which are going to be slightly repeating in this particular learning outcome and the assessment criteria. So it is important for us to understand the definition of these three different words: equality, diversity, and discrimination. And then we'll get into discussing some of the key legislations which we should be aware of as a healthcare professional, as a practitioner, as a person which works within the health and social care sector, or any of the related, setups like a care home, hospital, surgery, pharmacy, community center, hospital, A&E department. We need to be aware of some of these key legislations which have been introduced over the years, and how observing these legislations and having an understanding of these legislations, what guidelines have to be followed to ensure that when we deliver care or when we provide care to patients and to members of the public in this particular sector, we are making sure that we are not discriminating against race, religion, background, culture. We are ensuring that, most people are treated fairly, and they are able to get, a fair treatment with regards to receiving, care which is required, from the NHS. And then we also look at what are the sources from which this information can be gathered, which could be sources like, medical practice websites, policies, quality policies, which are, obviously made available by different, bodies. And these policies, when we look at, our policies which are going to be informing that how is the implementation of a particular, guideline or act needs to be done from an aspect of ensuring that some of these practices do not creep into the health and social care sector, specifically when we consider providing care under the person-centered approach or PCA approach. So we'll be looking at covering this through discussion by using a PowerPoint presentation, and I'll switch you over to that. There are a couple of slides that are put forward and created, obviously, to discuss this particular unit. And then what we will do is start with some of the key terminology and the definitions which are important for us to understand, what are these three important terms. So when we look at equality, what is the meaning of the word equality? So when we look at equality, equality refers to the state of being equal. That means we are going to treat everyone and provide everyone with the same opportunities so that they can fulfill their potential, or probably get the requisite, in this case, care which is required when they come in to receive treatment. So in the person-centered approach, the meaning of equality would refer to that we are able to recognize and acknowledge the unique needs, preferences, and abilities of each individual, and also then provide them equal opportunities for them to be able to participate, contribute, and benefit from the treatment being received. And that would be the meaning of equality, or the term equality applied to person-centered care. Now let's look at diversity. When we talk about diversity, what do we mean? It means that every individual is unique, and we recognize that there are individuals which are going to be different, and these differences make up the personality of that individual. So when we acknowledge that people are going to be different, and people will come from different background, ethnicity, race, they have different gender, their orientation in terms of, where they've come from a cultural background, their socioeconomic status, their beliefs, which could be religious, political beliefs, or any other type of beliefs, their physical abilities, they're all going to be different. And that is what makes one individual different from the other. So when we talk about diversity, we are referring to acknowledging, respecting, and appreciating these differences in people. But they are not going to be limited to differences that have been highlighted on the slide here. They could include, the differences which could be because, as I mentioned, race, religion, gender, age, sex, and any sort of disability that the individual might have. And when we relate this to the person-centered approach, what we are looking at is that diversity is to be celebrated. So in the NHS and in the National Health Service, diversity is celebrated and it's incorporated into all practices or all areas of practice within the health and social care sector and in the NHS. The aim here is to help recognize that every individual is unique, and we need to be able to respect the individuality of that individual and for what he or she actually stands. And this would allow us to ensure that, when we provide care, this care is going to be personalized. It will make accommodations wherever necessary to ensure that everyone's needs are met. And that is where we will look at the concept of diversity. Now, the last term that we will encounter again and again in this learning outcome is going to be discrimination. So when we talk about discrimination, what we are meaning by that is we are trying to distinguish, between different things, which is how do we treat someone and how do we treat someone different from some of the other people that we meet in our friend circle or in our place of work. And this difference in terms of dealing or making the other person feel that there is a difference being applied in terms of dealing with them because of their race, sex, religion, their background, their age, and other characteristics would be termed as discrimination. A simple example that I've mentioned on the slide is that I will mention here would be that when you can tell a difference between a fine wine and cheap wine. Now, when you make a comment between them and the way you make a comment to highlight the difference between the two can be discriminatory. So in some cases, when we look at discrimination, here we are looking at involving, basically, this would mean that it involves treating people or any person, from a different, say, group, race or background, and if we treat them differently in some way worse than others, if you are in general, treating a person which is going to be highlighting a different behavior in terms of your the way you deal with them or you talk to them, then in those cases, this would be seen as a discriminatory practice. Now, when we look at relating discrimination as a general concept to person-centered approach, what we are looking at is it is essential for us to understand that when we look at discrimination being, in the definition perspective, if we look at applying this to the person-centered approach, what we are looking at doing is we are making sure that it is going to be essential for us to actively prevent and address discrimination if it is happening. And how would this be done? This would be done by making sure that we are providing a safe and inclusive environment, which is going to ensure that everyone who's working within that environment is respected, is treated with respect and given dignity. And thereby we ensure that when we treat others with respect and dignity, we ensure that the anti-discriminatory behaviors are done away with from an aspect of dealing with the staff, with your peers, with employees, and even in this case with patients. So when we look at person-centered approach, there is a strong commitment to equality, diversity, and anti-discrimination. And this approach is recognized irrespective of the fact that whatever values, beliefs, background the person comes from, they are expected to be given the same or equal opportunities, which basically ensures that everyone feels included. Everyone feels that they are, being treated with respect and dignity, and that would allow, essentially people to understand that the NHS has no grounds or no space, or essentially they have no, space for things like, discrimination, or in some cases, it is enshrined into the NHS Act that all patients, staff, employees, contractors, suppliers, people who work within the NHS are going to be treated fairly and, be given the same set of opportunities in order to progress or, receive treatment without any discrimination. So this bit is quite important for us to understand, because when we talk about equality and diversity, we are looking at basically ensuring that everybody gets equal opportunities. There is a legal obligation within the NHS and the National Health Service to ensure that people are protected against discrimination. And if discrimination is happening, you need to be able to report it, actively be able to report it. And this particular policy of reporting it, or if it is being pushed under the carpet, then this needs to be reported actively. And in this case, sometimes when you're working within the organization and you have to make a complaint because there is a discrimination or, equality and diversity is not being applied, then you would be, looking at using the policy of whistleblowing, which is basically in confidentiality, disclosing what is happening to the relevant authorities in order to bring it to their attention and help stop this particular practice. Now, when we talk about equality and diversity, one of the key questions that you have to think about is, what does it mean to you? Equality, what does it mean to you? Diversity, what does it mean to you? So when we in general look at applying this particular aspect, when we talk about equality, equality is in general meaning equal rights and treatment to all individuals. And when we talk about diversity, we mean difference from what is normal or expected. So we are not going to differentiate between people or give different, treatments to people or treat them differently in case of and taking into account taking into account their background and race and culture and religion. And this is very important. And just to summarize, in terms of diversity, when we talk about diversity, it has very many values in which we can look at measuring or mentioning diversity. So diversity, we generally look at through the aspect of race, religion, culture, origin, gender, sexual orientation, age, marital status, disability, your family structure, your social economic status, and in some cases on the basis of, even looking at the individual abilities of an individual. And this will all be considered if you start looking at these factors and then react or then deal with that individual by taking into consideration some of these factors, then you would be seen as discriminating, because you're taking into account the factors which actually can be used to differentiate between people and the way people are treated. And that is why it is important for you to understand that where all will you not be looking at taking into account when you're dealing with patients or when you're dealing with individuals. Now, there are lots of sources of information through which equality, diversity, and discrimination within the health and social care sector can be informed. You can get information about it, from very different sources. And these include, say, for example, your manager, somebody who you are reporting to should be entitled to be able to provide you information related to, what does equality, diversity, and discrimination mean, which also brings me to the fact that in most organizations, you undergo some sort of a training to understand what is equality, diversity, and what is discrimination. So there are trainings which employees undergo, or when you join an organization like the National Health Service or some of the other organizations, you are expected to undergo a training to understand the meaning of these three terms and how they would be applied when you're using them in terms of day-to-day work. You could also get information from your co-workers, professionals, advocates, other practitioners which are within the setup. The additional information also comes from training and development, which is done by employers. It comes from the Quality Care Commission, CQC, your local authority, the professional bodies, which are, say, for example, the General Medical Council, the Royal College of Nursing, the British Association of Occupational Therapists. There are 16 such bodies which basically interpret government legislation and laws, and they would also then be looking at providing guidelines or publishing guidelines to update, some of these practices, and that is where you'll also get the information coming from. There are some key educational and health-related research bodies like the Social Care of Institute for Excellence, SCI. There is, the King's Fund. You talk about the National Institute of Care and Excellence. These are also bodies which will be publishing information related to equality, diversity, and discrimination, and then including guidelines in terms of how not to look at, say, for example, how to differentiate and how to incorporate these guidelines into your day-to-day operations so that staff is very well aware of what is equality, what is diversity, and what constitutes discrimination. Is that okay? Any questions on this so far? Any questions on the three different concepts that we are going to be looking at, or three different words, which make up this particular learning outcome, which is looking at equality, diversity, and discrimination? Right. So if we know the concept and the meaning of these three different words, then we also need to be able to explain what does this mean when we look at the context of health and social care. So when we talk about equality in the context of health and social care, it means that we are looking at providing high standard of care to all individuals, which is regardless of their personal characteristics such as age, gender, race, religion, their disability, or their orientation, sexual orientation. The aim is here to primarily ensure that everyone has equal access to the care services and same opportunities to achieve good health outcomes. That would be essentially how we would equate equality within the health and social care context. Now, the same thing, if I apply to diversity, this would mean that we are able to, essentially treat people with respect and value the differences which each of these individuals bring to the place of work, or in some context at the organization that they work. Now, in the context of health and social care, we are going to be applying diversity to acknowledge that each person's health and care needs may be influenced by their unique characteristics and experiences. You might come across, for example, you work, for example, your workplace, has people coming in and working who speak different languages. They are from different backgrounds. They have different religious beliefs. So in this case, the organization will need to celebrate diversity by ensuring that everybody feels included and nobody feels excluded when we are looking at, essentially taking into account the individual differences and the needs of the individuals to ensure that we are trained and we have received adequate training so that we are able to adapt our communication methods to meet the requirements of the individuals which are having different language needs, and hope that they would make the training and development would make us more aware of their culture, their individual needs, and also in some cases when we work as a health and social care worker or a professional within the sector, we are able to modify our care plans or at least provide care which is going to be bespoke to the individual's abilities and in some cases their disabilities. So we are able to take into account. And a simple example of this would be when you look at when you visit a hospital or when you go to a surgery, what you would generally see is, if I look at taking up the example of disability, for example, if there is an individual with disability, you generally see at a surgery there is a ramp or a wheelchair ramp which is normally made. In certain buildings, they have what is called a D1 classification, which means that you have disability, people who would be having any sort of physical disability would be able to access this building, and that would mean that you have provision for lift, you have a provision for a wheelchair ramp, or you have provision wherein disabled people with disability on wheelchairs, for example, would be able to have access to what are called toilets or facilities which will be clearly labeled and marked as for disabled, in order to ensure that they feel included and they are able to visit these premises freely. Now, we see the implementation of diversity happening in government offices and places is because every government building needs to advertise that they have access to wheelchair, they have access to, the facilities or the premises have access available for people with disabilities. And this is sometimes, advertised on the website as, with a particular logo, so that if you're visiting, say, for example, a particular office or a particular building, then, accessibility for disabled, you would generally see certain signs being put up, on the website. And if I bring one up, this is one such sign, which is, for wheelchair access. Sometimes you would see this sign being there, which is, wheelchair ramp available. You would normally also see that there is seating capacity available for people if they have to queue up in certain buildings, that there is access to the rear for people who would require, for example, mobility related, let's say provisions. You would also see this as an example, a wheelchair access lift, which will be installed in some of the buildings. And this is celebrating diversity. So all government offices are required to basically, have these kind of signs displayed prominently, which basically, help understand and, advertise to a certain extent that there are adaptive capabilities available to individuals with disability, just as an example that I've shown, that they would then be able to access this building or premises irrespective of any, disability that you might have. Now, when we talk about discrimination is basically unfair treatment to a person or a group of people. That is what the basic definition is. Now, if I say a simple example of discrimination in the UK would be just outside the, health and social care sector, if a business is to advertise that we are looking to hire a receptionist and they would mention in the job advert that female candidates only apply, then this would be treated as discrimination, simply because you are eliminating 50% of the applicants just because or more, just because they are qualified, they have the experience, they're able to take up the job, but you advertise that only female applicants apply for this role. Now, this would be seen as discrimination, and the job posting or the job advertisement would have to be taken down. But in the case of, say, for example, health and social care context, what we are looking at is discrimination would be when an individual is treated less favorably due to their personal characteristics such as race, religion, disability, or sexuality. Now, this can result in poorer health outcomes and a lower quality of care being provided. So a simple example of this would be that when I look at discrimination, if the local authority starts discriminating, saying that, okay, this is an individual which doesn't pay taxes or, doesn't contribute to the society, we will not be looking at providing adequate support in terms of, say, for example, in some areas. Now, this would be treated as discrimination. So in this case, if this is vetted out, this would mean that there would be differentiation in terms of how the health outcomes would be affected in a local population. So discrimination can be of various different types. It can be direct discrimination, indirect discrimination. It could be direct discrimination could be something like refusing care to a particular individual because of their characteristics or their background. It could be because certain policies and practices which have been implemented take into account a specific type, and then it uses that particular type to be able to discriminate against that individual, to debar that individual, or to deny that individual the services, in this case the health and social care services. And in some cases, some form of discrimination can also be treated under the Equalities Act of 2010, wherein they are treated as being illegal. So if you refuse somebody, if you directly discriminate or indirectly discriminate by implementing policies and practices within your organization, then you can also be legally liable and sued under the Equalities Act of 2010. So in general, when we look at covering this particular assessment criteria, what we have to be able to do is explain the concepts of equality, diversity, and discrimination. But what we also have to do is basically look at giving an example of each type and where we feel that discrimination can be vetted out, or equality is not being observed, or diversity is not being celebrated, or it's not being applied in terms of the day-to-day working, or when we are providing services to the patient in any sort of a health and social care setup. This would help us cover and understand what is equality, what is diversity, what is discrimination in the context of health and social care, and the example that you would provide at the end of it, like in the case of equality, the example, if I look at an example of equality, so if you, in the context of health and social care, if I ask you to think of an example of equality, where would you see equality being applied in this case when we look at the concept of equality as an example? So one such example that you would give out would be that if you're, say, for example, visiting your surgery, and in your surgery, if you're visiting and you're basically going in and you expect that the surgery treats the individuals with equality, or gives or looks at equal opportunities for everybody, then in those cases what you're looking at is that at any given point in time, if I want to take an appointment, then there is no discrimination, no way that any sort of refusal is given or a specific time for me is given. Then in those cases you're observing equality. So it could be, for example, if I call the surgery up and I'm on a waiting list, and then they ask me who you are, where are you from, and why you want to see. Then if they say no, for this treatment, you are required to, obviously, log an appointment and go and see a pharmacist, or all the appointments for today have run out. Sometimes it does happen when you call in the morning for walk-in surgeries. Then in this case, how do we see that equality is being observed or not? So in this case, when we say an statement, which would be a poster or some sort of an announcement which is put up on the notice board in the surgery, which would be a policy stating that every patient, regardless of their age, race, religion, disability, orientation, socioeconomic status, would have the right to receive the same amount of care from the practitioners in the surgery. Now, in practice, this could involve how they would be looking at doing this. In practice, this could involve that you are given equal time during appointments when to discuss your health problems. It could also mean that when we look at equality, that would mean that you have the same access to the diagnostic tests or treatments which are required or given to any other patient. Equality could also mean that you receive the same level of respect and person-centered care primarily from the staff. Now, in some cases, you would also see that equal opportunities would mean that you are also looking at getting, the same amount of information in a format which you can understand. So, for example, if I don't speak English and English is not my first language, now one of the things which the surgery would need to implement in terms of their policies would be to have leaflets or information leaflets available in different languages. So generally, when you enter a census and when you say what is your first language, and some of us say first language English, first language Arabic, first language Urdu, first language Hindi, or first language say Punjabi or whatever, then in those cases Jewish, for example, or Hebrew, then it is when I look at implementing equality or the implementation of equality policy within the surgery, their responsibility would be to ensure that they know how many patients are registered from a particular background. And in those cases, when we say equality being applied, they would make available the information in the form of leaflets. If they are printed in English, they're also then available and published and printed in other languages, depending on number of patients which are, registered with them in the surgery. And in this case, we would treat this as an example of equality policy being implemented and recognizing that people have different needs, and these different needs would be vetted out by ensuring that leaflets in different language are made available so that information can be shared, and this would allow the patients to get the relevant information as required from time to time. In some cases, you would also say, when you are visiting the surgery, the doctor, if English is not your first language, the nurse or the GP might ask you, do you need an interpreter because English is not your first language? So offering the services of an interpreter to the patients who do not speak English as their first language would be ensuring that everybody is getting the equal opportunities to be able to discuss their problems with the GP. And this would mean that the equality policy is being applied within this context. So when we talk about assessment criteria 2.1, it is going to be important to define these three terms and then take up an example of equality, diversity, and discrimination, and how anti-discrimination practices can be deployed within an organization, and that specifically within the health and social care context would help you meet this criteria. Now, any questions on this so far? Now, you can ask me questions through the chat route as well, not a problem. And if it is understood, I'll move on to the second criteria. Now, the second criteria talks about describe legislation on equality, diversity, and discrimination that promotes a person-centered approach. Now, in the previous one, if I bring across wheelchair access, which is available within the surgery, this would mean that there is equality policy being applied, and people are, being given access to the premises, even if they have a disability. And that would be an example again of how, you would generally see diversity or equality, depending on how you treat this and explain, you could basically look at giving an example in the health and social care, context. So there are various ways in which you can, explain this, and that is going to be important in the previous criteria. Now, going further, we are looking at the key legislation which are involved, in terms of the delivery of person-centered approach or person-centered care. And when we look at this in particular, we are going to be looking at considering a number of acts that we need to be aware of. And these acts would include the Human Rights Act of 1998. We'll be looking at the Equality Act of 2010, Mental Capacity Act of 2005, amended in 2007. We will also look at the Health and Social Care Act of 2010, the CARE Act of 2014, and these would be some of the key legislations that we need to be aware of when we talk about, equality, diversity, and discrimination or anti-discriminatory practices being used to promote person-centered, person-centered care or person-centered approach within a setup. Now, there are several key pieces of legislation that the UK government and the UK Parliament has introduced over the years, and some of them tend to be in no particular order. But we will start with, say, for example, the Human Rights Act of 1998. Now, this act essentially, which was set out in the 1998, and then later on in the European Convention of Human Rights, it clearly says that as an individual, you have certain rights, and these rights can be exercised against public authorities when you are, feeling discriminated against the state. So, for example, you have certain rights and responsibilities, and if you feel that the public authorities are not, treating or providing fair treatment to you, then in such cases, you could exercise the Human Rights Act. Such an act would allow, it has 8, or I think, to the best of my knowledge, it has 13 articles in total. And under this Human Rights Act, what happens is that it gives the individual a right that public authorities must generally respect. And in such cases, they should respect your rights to be able to choose and also to be able to look at ensuring that no inhumane or degrading treatment is done. For example, torture is done in certain cases when you are against the, when you and the, let's say, the government setup or a public department is at odds. So in this case, the Human Rights Act essentially respects the right of an individual to private and his family life. It is also fundamentally ensuring that when care is being provided primarily by taking into account your preferences and your needs, and the care that is being provided will be provided respectfully and in fair means, so that there are no ways that you feel that you are being discriminated against or you are not being given the fair treatment. Now, when we look at these acts in general, if I show them to you, say, for example, on the website, there is a website under which you can go in and check any legislation or any act which has been introduced by the government. And this legislation or act, when you want to check, and let me just show you, just for the purposes of your understanding, you should be able to, do this independently and see where across you can go in and check the key legislations which are introduced by the government. So if I switch you over to this particular website, as you can see, the website called legislation.gov.uk. This particular website has all the key legislations, which acts and legislation which the UK Parliament has published since it was, started. So since, and then there is a table of content, and you can go in and you can look for all the acts and their schedule and their detailed explanation. Now, if you need to refer, say, for example, to any legislation, you should be able to click on Browse Legislation and then choose, for example, legislation which could specifically apply to the devolved nations, Scotland, Wales, Northern Ireland, some of the new legislation which is coming in after we have done the Brexit, and in some cases, even legislation which is under draft right now in terms of first reading in the Parliament, second reading in the House of Commons, third reading, and then it goes to the House of Lords. So if it is under that stage of going through the approval process, you can also see some of the draft legislations, through this website. Now, in terms of understanding legislation, obviously there are loads of them. What we would need to do is be aware in terms of how to go about searching the website for appropriate legislations or acts that you want to see. So when I click on UK, there are all these different acts which are defined. And in some cases within these acts, you need to again go into different sorts of acts. So generally speaking, best option is to normally look at, putting the title here and then doing a search. and that should give you the details of all the necessary acts that you would want to look at from a point of view of studying and maybe increasing your knowledge about in general, and that would be a good start. So specifically when it comes to doing assignments and doing your research, I think it is important that you are aware of this website, and it could be a good starting point for you to look at building your knowledge should you want to go into a bit more detail. Now, there are lots of, when it says describe, we are looking at giving a description of the act, the definition of the act, and what does the act entail from a health and social care point of view. Now, within the health and social care point of view, we are also not looking at broadly the health and social care point of view. We are looking at a person-centered approach under this particular act. So when we talk about these, we are looking at, protection of fundamental rights in terms of what care you would receive, how you would receive. If you feel that this is not something that you want to get or receive, or maybe, should be administered to you, then in those cases, the person-centered approach comes into being, and that would fall under, the Human Rights Act. Now, it would also highlight the duty of public authorities under the Human Rights Act to be able to provide you safe medicine or safe medication and safe treatment, so that you're not put into the harm's way, or you're not receiving or having any side effects after receiving that treatment. And in some cases, the Human Rights Acts would also empower you to bring across legal proceedings against the authorities if you feel that the treatment which has been provided has led to more side effects or problems than you receiving benefits. And one of the things that you would generally see that this allows you to do is a few months back, I think there was something in the news, a French company which has introduced breast implants, and those PIP implants essentially, can cause cancer, because if the implant actually splits or leaks, then it can lead to development of cancer within women. Now, there were 38,000 women which had got these implants, and the NHS, when this was found out, and obviously, legal proceedings were brought against the company, the UK government and the NHS has now authorized 38,000 women to essentially get those implants removed free of cost. And in some cases, if there are wait times which are excessive, then the NHS is also paying for the costs to be able to get them removed privately. And this falls under the Human Rights Act of 1998, because when you are against, you are fighting, or you and the state are against odds, then in those cases, your fundamental right to be able to receive treatment and care under the person-centered approach is protected under the Human Rights Act. And that is what you would need to understand, that if you were one of the recipients of that implant, even though you had got it done privately, but because the implants have now been discovered that they're unsafe and can lead to cancer, you can bring legal proceedings under this act, which allows the individuals to, take the public authority, in this case, to court, because they have not, done their due diligence at that point in time when these plants were approved. PIP implants were approved, and had the due diligence been done in accordance with the process and the procedure laid down by the government, then these implants would have never been approved for planting, or for use within the UK. So in this case, you can seek to redress this particular violation under the Human Rights Act, and this is treated as an example of how you would, apply this to the person-centered approach. Because if you were one of the persons who had received these implants or had got it done, then you would be, in line to receive either compensation or removal of this breast implant, because the due diligence by the government authority or relevant authorities was not done. Now, let's move on to the second act, which is the Equalities Act of 2010. Now, we have, when we look at the Equalities Act of 2010, or when, this act was essentially introduced, it basically looks at, treating people fairly. And any sort of unfair treatment meted out to an individual on the basis of their gender, race, religion, basically can constitute injustice, or, injustice in terms of, services being provided to that individual. Now, this act has about 9 different characteristics, and these characteristics or traits which basically allow us to understand whether the individual is being treated fairly or treated equally or not, would include these 9 parameters, which will include age, disability, gender reassignment or reassessment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex, or your sexual orientation. So if any of these traits are brought into while delivering treatment to you or creating your personalized care plan, then you can claim that you're not being treated with equality, or you're not being treated with fairness. And in this case, it would mean that there's a violation of the Equalities Act, which the government has put in place to ensure that discrimination in various areas, including employment, education, housing, public services, and mainly in the provision of healthcare services to the members of public, does not happen. So it sets out, the Equalities Act actually sets out these discriminations which can be meted out in these 9 traits or parameters, and using any of them against the individual by not refusing or by not providing them the fair service, which is in the case of healthcare, would be treated as not being treated fairly and not being, not implementing the Equalities Act of 2010. So this act was introduced by the government essentially to ensure that we are able to promote equality, we are able to prevent discrimination, and we are able to foster a very fair and inclusive society within the UK by, introducing this act. Now, if we look at an example, of Equalities Act, and if we look at that you have not been fairly treated because one of the characteristics has been taken into account to discriminate against you, then again, you can use this particular act and make complaint to the appropriate authorities, which would take action against and make sure that even to a certain extent, the organizations can be fined or can be put under some sort of a corrective action plan to be ensuring that they have implemented this policy and their guidelines to its core. Then we look at there are lots of different acts, but in one particular act that we look at, which is the Mental Healthcare Capacity Act. And when we look at this particular act, it's quite important, to understand this, is because when we are dealing with people in situations which are, over the age of 16 and are unable to make informed decisions because of disability, because of mental, capacity, or they lack the capacity to be able to make their own decisions, then in these kind of cases, you would look at considering the Mental Health Care Act, because this legislation will ensure that people with serious mental disorders, which, are threatened with, say, for example, their own health and safety, or safety from a point of view of, being mistreated by the members of public, then in those cases, it is important that we take consent and wherever necessary, use the means to be able to prevent them in particular from harming themselves or others. And this particular act, basically provides that framework within England and Wales in particular, wherein the people would have severe, say, for example, lack of any capacity to be able to make their own decisions. And these decisions, when they make these decisions, have to be made for them. But in this case, when these decisions are made, a person is appointed. That person could be appointed under the jurisdiction of the court and may have the rights and powers to be able to take decisions on behalf of that particular patient. And this would be done in conjunction with, the guidelines given by the court. And this allows the individual to function and live a normal life. So in some cases, these individuals are also being used to prevent any harm that they can do to themselves or some of the others, because again, the reason why this is being applied is because they lack the mental ability to be able to, make any informed decisions. And this could be because of various things: disability. This could be because of their lack of mental capacity or some sort of a terminal illness, which impairs their capacity to be able to make these decisions. So this is, again, an important act that we need to be able to look at when we decide on care and treatment which is provided to individuals. For example, in the case of dementia, Alzheimer's disease, and in places wherein people have suffered irreparable loss to the brain, and they have lost the capacity to be able to make decisions. One of the other acts that we would want to look at in particular is the Health and Social Care Act of 2010. And this particular act that we look at, is basically informing us on, the let's say the main legislation behind this particular act is to support collaboration and partnership working, within the health and social care sector to be able to provide integrated care to patients. So amongst the wide range of changes, which the government typically included in this act, it also included changes to public health, social care, and in terms of how quality of care can be provided, and within the remit of being, secure. That means health and safety of the patient being guaranteed when these treatments are being provided, primarily to the patient. So when we look at the Health and Social Care Act, it was revised in 2012. And when it was revised in 2012, what the government did was that it basically created specific organizations in England and Wales, and it provided them greater autonomy to be able to make decisions to provide services which are patient and care services to the patient, under the NHS. So, and this led to the establishment of what are called the CCGs, the Clinical Commissioning Groups, or it also led to the creation of a body called Public Health England, PHE. And for some of you who have been tuned or have looked at the news during COVID, a lot of the, say, for example, guidelines to prevent the spread of COVID and to stop the, spread of COVID-19 virus was actually introduced and underwritten by the Public Health England Authority, which is messaging that they create under the Department of Health for the, let's say, for the benefit of citizens of the country. So things like space, face, and social distancing, these were terms which came out of PHE because they are a executive agency under the Department of Health, and they are responsible for providing national leadership and coordination on public health issues. So under COVID pandemic, they were heavily involved in, promoting and providing messages which would help in the prevention of the COVID-19 virus. Now, the Health and Social Care Act of 2010 and 2012 also created a specific role for the Quality Care Commission, CQC. And they enhanced the role of CQC as an independent regulator to be able to check health and social care providers, to ensure that they are regularly inspected, to ensure that they are, meeting the guidelines which are required for them to be able to, let's say, let me just refresh the screen. So they were primarily, looking at ensuring that some of these guidelines which was introduced, under this particular legislation, meant that the role of CQC was enhanced so that they could regularly inspect the health and social care providers. In some cases, restrict their services that they provide, because if the services are not meeting the guidelines in terms of the quality of care being required to provide, then this regulator could also go in and restrict and even put sanctions on the health and social care providers. Now, the Health and Social Care Act actually, set up, let's say, various organizations within or under the Department of Health, and that would allow it to run the operations and provide services to the members of public more efficiently. So the creation of clinical commissioning groups, the establishment of the executive agency, Public Health England, more autonomy to the NHS Foundation trusts, enhancing the role of CQC, and also looking at forming the health and well-being boards were done under this particular act. One of the other signature things, with this act was that it also included patient involvement in the process of providing feedback. So when practices, when practices have to be improved, or when processes have to be improved and best practices have to be introduced, the Health and Social Care Act of 2010 and 2012 introduced patient involvement as a key parameter in decision-making process in terms of how care and treatment and planning and provisioning of these services by local authorities is done. So this act sees a fundamental shift in terms of how the planning, provisioning, and implementation of services is done within England and Wales, and that is why this act is very significant when it comes to person-centered approach. Now, there are loads of acts, and obviously one of the key acts that I want to look at is the CARE Act of 2014. So when we talk about the CARE Act of 2014, what we are looking at is primarily, talking about the act which allows, if I put it this way, which basically was introduced by Parliament in 2014, but this CARE Act essentially, allows for adult social care in England to be provided. So when we look at the provision of how healthcare is provided, it is already there. But when we look at the provision of social care or adult social care to be provided, this was established under this particular important piece of legislation in England and Wales. So this piece of legislation actually governs how social care services are provided and regulated. So if I look at in a few words to explain, and if I ask you to say, what does this act actually stand for? What you're going to say is that this is an important piece of legislation that governs how social care services are provided and regulated. The key word is social care services. Now, this was introduced because one, there was a modernization required from the Health and Social Care Act of 2010, 2012 to be able to differentiate between social services and healthcare services. The second part was to also look at putting, or I would say providing emphasis on promoting individual well-being and safeguarding, which is primarily, required when adults or vulnerable adults are put at risk, and they need to be able to provide better support. They need better support, which is provided through carers, which is coming under what is called the social care services. So in general, this act created features or basically provisions for social care services to be provided to adults. And when we talk about the person-centered approach, here we are looking at the aspect of promoting individual well-being, safeguarding for adults which are at risk, and providing them better support through providing social carers social workers essentially who would provide this support as carers. So the Act places an importance of social care services, the essence of well-being in adults which are vulnerable or at risk of any sort of vulnerability, and it ensures that people are fairly assessed and are eligible to be able to receive these social care services from local authorities or in local populations wherever they are living within England and Wales. So again, an act which basically is important because here social care services were essentially, differentiated from healthcare services. And this was let's put it this way, a signature act, because it first and foremost separated healthcare services and social care services, but also ensured that people who are vulnerable or considered vulnerable are able to receive fair treatment from within the National Health Service and within the health and social care sector. So an act which is again important from a point of view of understanding if you're working within the health and social care sector as a health and social care professional. Any questions on this so far? Okay. Now, some of you did mention that your screen was still showing the legislation, but I hope you're able to see the slides now. Now, the last part of the assessment criteria here talks about describing the different sources of information which can be used to provide advice and support the guidance of equality, diversity, and discrimination and their implementation within any part of the organization. So when we talk about this particular assessment criteria, here we are looking at what are the various sources through which you get this information if you're working within the sector. So the first part that we would look at would be how would you apply your knowledge that you get in terms of one is first, how would you get this knowledge? Second, how would you apply this knowledge? And the third, how would you use this knowledge in situations wherein you feel this equality, diversity, and discrimination is not being meted out fairly? Now, if you look at some of the resources through which this will be made available, one would be company policies and company policies and procedures. Now, all healthcare providers are required to essentially have various policies on equality and diversity, safeguarding discrimination. These policies would inform the organization's position, their commitment to implementing the guidelines, which are from various, acts like the Equality Act, the Anti-Discriminatory Act, the Safeguarding Act of 2014. And this would inform that the information given in these policies are being signed off by the management, and the users or people working within the organizations are adequately trained, and they have a very good understanding of how these policies have to be implemented and are implemented within the organization. The second place where you will get this source of information would be the government's Equality Commission. Now, in order to promote equality and human rights in England, Scotland, and Wales, the government has set up this commission, which is called the Equality Commission, and it is called the Equality Advisory and Support Services, as an agency, which is called the EASS. And this particular agency is able to provide free advice and support on matters relating to equality, diversity, and discrimination. Now, it provides messaging in the form of leaflets, information through its website, and this is done both for the end user and also for organizations to ensure that they are able to, implement these guidelines, which are in line with the government policies and, legislation. Now, the third source would be advocacy services. So when we talk about advocacy services, do you know the meaning of the word advocacy? Anybody? Advocacy, what does that mean? If I look at advocacy services, what does that mean? So advocacy essentially, if I look at the dictionary meaning of the word advocacy, basically it means that you are providing public support, or you're recommending a particular cause, or supporting a particular cause or a policy. So advocacy refers to basically the act of publicly supporting, promoting, or defending a particular cause, idea, or in some cases, a group of individuals. Now, this would mean that if we look at the aspect of advocacy, it aims, from a government perspective, it aims to influence public opinion. It will also, influence decision-making processes and policies in order to address some of the wider social, political, environmental, and even, human rights issues. And that is where the concept of equality, diversity, and discrimination creeps in. So here, this would mean that the government has a department through which it provides these advocacy services, and they could be basically used by different government departments, institutions, providers, to be able to get support on developing and implementing equality, diversity, and discrimination guidelines within their own organizations. And this is a free service which the government actually provides, simply because they would want the law and the legislation to be interpreted correctly. And once this is interpreted correctly, this is adapted into the organizations for the purposes of delivering services to the members of public. Now, advocacy in the case of social care would be independently managed by local authorities or councils, as we call them, and the National Health Service. Now, there would be people who would be trained and developed to understand and provide these services. They would understand individual rights. They would know how to express their views and opinions, and they would also then be very careful in terms of informing relevant authorities should the remit of their role go beyond just the advice and guidance side of things. So you would generally find advocacy counselors working within the local councils, and the local councils would then use these advocacy counselors to be able to provide information to members of public on equality, diversity, and discrimination. Now, there is an important body which I think everyone who's in the UK has heard about, and this important body is the Citizens Advice Bureau. This is a body which basically is a let's say a charity, or it is a non-government body essentially, and which basically provides free and fair services on as an independent organization. It provides free and fair services which are confidential, and they can be on any areas of help that you need. It could be on areas like healthcare, in terms of debt, in terms of housing, in terms of your rights, human rights, in terms of equality, diversity, and even in terms of legal aid, which should you need to go against and file for court to recover or sue anybody, or even recover charges. So this, as an organization, is a charitable organization which offers free and confidential and impartial advice to individuals on a wide range of issues. And it could be from I would say healthcare to finance, to housing, to matters which are related to an individual in the context of employment and even welfare, immigration. It has got a wide remit. But this is one of the bodies through which you can also get information about equality, diversity, and discrimination. That is what we are discussing. Now, the one other body which I would like to mention here would be the CQC. The reason I'm mentioning CQC here is because when we look at information at the individual level, and when we look at information at the organizational level, there is an organizational, information at the organization level would be different from what you might want to get as an individual. So when we look at the CQC as a regulator, an independent regulator of health and social care services in England, CQC would provide information on how do we promote equality, diversity, and discrimination, anti-discrimination practices, which can be applied and promoted within the organizational setup. Now, they would obviously carry out regular inspections, provide guidance through their website. You can approach the regulator in terms of developing your own guidelines, and they would then also monitor and regulate these, when I say I mean the setups, which could be a care home, elderly age home, hospitals, any sort of a setup within the health and social care sector. They would be monitoring, regulating them to be able to see if the guidelines have been published and implemented as per what they have published and prescribed from a point of view of promoting equality, diversity, and anti-discrimination practices. Any questions on this so far?
Hello.
Right. One last bit which we want to quickly look at in terms of the distinction criteria is primarily looking at how does the government promote this as an agenda at the national level. So when we talk about the government looking at promoting this advice which is related to equality, diversity, and anti-discrimination, at the national level through the national initiatives, what we are essentially looking at is the government actually looking at publishing guidelines, which are guidelines related to the codes of practice, the the care side of things, which is values in care, the 6 C's of care, and some of them in terms of practical applications like the feedback questionnaire or any sort of a feedback mechanism, which is pooling in information from the patients, or in this case, the customers, which are basically receiving the health and social care services, and then pooling them back into the system to implement and bring about changes within the whole setup. So here, if I have to talk about health and social care organizations and various kind of initiatives which the government would take to promote equality, diversity, and ensuring that they're able to help develop practices which are going to provide person-centered care. Some of these policies and practices would essentially come from the acts and legislation which it introduces. And these acts and legislation which it introduces are then interpreted by key regulators like MHRA, CQC, NICE to be able to bring out guidelines which then can be used within various departments and various types of care setups to be able to ensure that equality, diversity, and anti-discriminatory practices are being used within the organization. Excuse me. One last thing which I'd like to introduce here, because it says assess the effectiveness. What we are looking at is not doing this as a separate task, but what we are looking at doing is bringing across one of the acts that we have looked at in today's learning outcome, and then presenting the arguments for and against that, and then explaining how this helps in the development of anti-discriminatory practice within an organization. Training and development and of the staff is an important step, and it plays a very crucial role in ensuring that equality, diversity, and person-centered care is practiced within a care organization. So if I put it this way, and if I have to assess the effectiveness of national initiatives, one of the key things which I would give out as an example would be that every organization within the health and social care setup needs to conduct a diversity training that can help staff understand and value the differences between people and the care which is required to be able to be given out to patients when they come in to receive care in that particular setup. So this would equip the training and development was essentially equip the staff with the skills that would help them essentially ask the right questions and practice the right, basically provide the service in the right way, which would take into account the values, the beliefs, and the preferences of the patient, and thereby making sure that equality and diversity, that means fairness, is being applied in delivering that treatment to that patient. And some of these initiatives that I would say that the government takes is also implemented within organizations with the use of technological, advancements. Things like when we have, and I'll give you an example here, when you go to a surgery and you are going to meet a doctor, if you have a disability, which is a hearing disability, then in some cases you would see that the surgery would have an option wherein hearing in loop is installed. Or in some cases, you would see if you have a physical disability, wheelchair access or ramp are essentially, available for you to get access to the premises. When you're in the premises, if you need to use facilities like the toilet, there are disabled facilities, which are available for the patients to be able to use. And that would essentially mean that the government's guidelines and implementation of these guidelines is being done within a particular organization, and that is where there is no discrimination against the individual depending on the ability or the disability that they might have when they want to access those premises. And this is what you would need to explain with an example within this particular, criteria. Another example that you could take, which is related to staff recruitment, and I'd given an example earlier that if an organization was recruiting a receptionist and they advertise that female candidates only apply, then they would be discriminating. So generally speaking, when we look at staff recruitment policies, these policies have to be written in a manner which are going to be promoting fair processes, and they are going to be non-discriminatory. That means they would include commitments to equal opportunities. There would be clear written out procedures to ensure that job applicants are assessed solely on the basis of their ability, not on the basis of their appearance, the background, or the culture they come from, and things like that. And this would encourage applications which are being received, from unrepresented or underrepresented groups within the society. So whichever example you take, whether it's learning and development of staff, whether it's staff training recruitment policies, whether you look at the policies and procedures which are released by the government in terms of acts and legislation, you would need to present the for and against, benefits and disadvantages, and then basically relate them to how they help in the contribution of anti-discriminatory practices within a health and social care setup. And that would be by covering the theory, a bit of application, and then towards the end, taking a specific example, and that would allow you to do the assessment, of how these national initiatives, which are, used by the government to promote anti-discriminatory practice within, the health and social care setup. So that brings us to the end of today's session. And if you have any questions that we have discussed, feel free to ask me now, so that we can, go through, or, obviously I can provide you additional information after the session. Any questions? Right. So if there are no questions, I'm going to try and end the session here. There are some handouts that I'm going to put specifically on certain, bodies like the CQC, the Care Quality Commission. I'm going to put out a bit of a handout on, the various different types of acts that you need to be aware of. And these would be good for the purposes of your reading and, building knowledge on some of these key agencies which are, related to learning outcome 2. So make sure that you read some of these handouts, simply because they will summarize the information about these key agencies, in about, I would say, good amount of detail, and it should give you an understanding of how to use it when you come to doing your assignment for this particular unit. So, okay, I would like to end today's session now here, and we'll catch up with you next Tuesday, because next Monday is a bank holiday. So the next session will be on Tuesday, same time at 11 a.m. And we will be covering learning outcome 3 for this particular unit. And this session would also be available in the form of recording and also on YouTube, just in case if you need to revisit it for the purposes of review. Thanks so much for attending, and bye for now.
Thank you. Bye.
Bye.